What up, AJ?
What's up, bro?
You look a little slimmer, bro.
I'm not on Ozempic.
Are you sure?
Or Wegovy or Mounjaro.
It seems like every person I meet now after Kim Kardashian is on Ozempic.
Bro,
They got so slick with it, they started changing the names of it.
They really did, bro. They'll use the same medication, change it, and be like, oh, this is for weight loss now.
Yeah, yeah.
You know? That's what Wegovy did, right? I mean, Wegovy, then you got Mounjaro, you got Ozempic. Initially, I mean, I think this is a very, very popular topic, I would say. But reality of it, it works.
And most
really
people
works.
don't know what it is. But when you say it works, be very specific to what it works for, right?
Yeah.
So if you're going to get a 30-year-old female that's not overweight and asking you to do it because she has a little bit of love handles,
Yeah, it doesn't.
it's not what it's meant for.
Yeah,
right?
but there's
like,
it's different. There's the guidelines. Actually, what they recommend is if you have a BMI over 30, then you qualify, for example. But other people who have a lower BMI, let's say 27 or above, you got to have risk factors. High blood pressure, high cholesterol, then you qualify to be on that
but
medication.
didn't Ozempic, isn't it really a diabetic medication though?
Yeah, it started out for diabetes.
So what did they
It was
change?
FDA approved for diabetes. Well, it's not that they changed it. What happened was patients were on Ozempic for diabetes.
Yeah.
All of a sudden they're losing weight, right?
And they do lose weight. My patients were losing weight.
And we'll talk about the
but it's
physiology
so
behind it right now.
expensive. Oh my
Yeah,
God.
it is expensive. But
Yeah.
you know, they've been on tons of medications, nothing is working. They try Ozempic, the A1Cs are better controlled. Why? Because they're losing the weight.
Yeah.
Ultimately lowering their cholesterol, lowering their cardiovascular risk. But what happened is patients started to lose weight and they realized, wow, this medication is actually great for weight loss. So a company came and said, hey, we're going to use the semaglutide or, Ozempic.
Well, they gave it to Kim Kardashian. Kim
Okay.
Kardashian is the one who popped it off.
Switched the name to Wegovy, hired the dose, and now that dose is specifically for weight loss. The
Yeah.
2.4 milligram dose. It's an injectable every week, okay, once a week. And a lot of people lose weight. I mean, I see on an average of 30, 40, 50 pounds of weight loss over like a 60 to 70 week period. But
It's also has a lot of side effects. I have a friend that did it and she wasn't too much overweight. And for literally 2 months, she puked every single day,
Yep.
couldn't tolerate any food. She had chronic nausea and she just felt horrible,
Yeah.
horrible. And obviously she lost weight.
of course.
She's like,
because
I lost
they're
weight
not
because
eating.
I've been puking every day and I have abdominal pain.
I-
And what about those patients? I had also patients that took it for a long period of time and now could no longer afford it. Their A1C went from like 10.5 to like 6.8
Yep.
and then
It
stopped
shoot
it and it went
right back up.
up.
But see, that's their fault, MJ. It's their fault because they went back on their routine diet. You see
Yeah.
what I'm saying? What we have to take into consideration is every single patient is going to be different.
Yeah.
You might just get nausea. I might get constipation. So it's like diarrhea, constipation, headaches, vomiting. There's so many side effects. Not every single person will get all the side effects. Some
Yeah.
people might get all of them. Some people might just get diarrhea. Some people
Yeah.
might just get nausea. So I think you should talk to your doctor first before starting it so you can understand what possible side effects you'll get. Second of all is try it out for 4 weeks. And if you're feeling good about it, then we could go ahead and increase the dose, for example. Okay. And you need to start out on a lower dose typically and increase the dose every month. But yeah, Mounjaro, same thing. I mean, it's everything is becoming a weight loss frenzy and it's all over the internet, right? It's everywhere.
It's like one thing gets popular, like phentermine for a long, long time was just like so popular, but like
Yeah.
you have to get an EKG, we have to worry about arrhythmias and have all these side
Yeah.
effects. And now people are like, oh, that's bad.
Yeah.
Ozempic came in and then the next one. It's just like whatever is popular, that's what everybody jumps on.
Yeah.
But there are a lot of side effects to these things. And for me personally, I know people love it and it does help. But if you're like 400 pounds and you are really cannot lose the weight, your A1C is out of control. Yes, I feel like it works great for you, but just those younger generation, just stop being a lazy ass.
Yeah.
Get up and work out, exercise, watch your diet. Why do you need a medication to inject into yourself to lose the weight? I just don't.
It's a little bit controversial, MJ, because I kind of agree with you, but I kind of disagree with you on terms because there are a lot of people who will diet and exercise and don't lose the weight, unfortunately. And they've tried and they tried. Yes, you can't expect, there is no easy way out of this, be honest with you. The best way to lose weight is lifestyle modifications, increase exercise, okay, and watch what you eat. If you're not going to follow that, then you're not going to lose the weight.
But what you just said right there is what my biggest problem is a lot of times with physicians. You get this person that has no education, no background, and you tell them diet, exercise, lifestyle. They don't understand what the hell you're saying.
Yeah.
Like, so that's why we got to before we jump and say, don't take Ozempic, just diet, exercise, lifestyle modification. What the hell does that mean?
Yeah.
Like, got to break it down. Like, hey, what are you eating in the morning? I'm eating very healthy. He's a diabetic. What are you doing? Grapes all day, pineapples all day, kiwis all day. And you're like,
well,
I
that's your
thought that
problem.
was healthy.
That's
and
your
they
problem.
don't know. And so I feel like that's our job as physicians is to tell them, guide them before we get to the point where we get to Ozempic. Here's your diet. This is what you should eat. Here's the foods to avoid.
Yep.
When you go to the gym, this is the exercise you should do. Start off with a bike, do this, blah, 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 and guide them into it instead of just saying lifestyle modification, diet, exercise, and then they have no idea what they're doing. Hey, doc, I tried what you said. Give me Ozempic.
Yeah, but see, everything that you said is for a perfect 30 to 40-year-old who has money. If you're talking about the 72-year-old who is on a fixed income, can't afford healthier meals, can't really move much because of arthritis, and their A1C is 10.2, then Ozempic might be a good choice for them because it will help them.
But you just said
it
it doesn't have money. Ozempic is expensive. And
if the insurance will cover it.
It puts you in a donut hole. That's not going to be
if
good.
you're managed care, but if you have good insurance, that's a PPO, and they're willing to pay for it.
Do you think insurances are paying for it?
There are insurances that pay for it. Now, Wegovy and Mounjaro are brand new, and they're a lot different. Yeah, but Ozempic right now, it is. And you know what's happening? It's on back order. Well, now they finally got it.
My patients can't even get it.
Because everybody's prescribing it for weight loss programs.
It's causing a problem, though,
it is.
man.
But do you understand the mechenism behind how it works, though?
No.
It's a GLP-1 agonist. What it means is just basically it's hormone. You take in the injection, right? You inject the medication. What that will do is will give you this sensation of, it's a GLP-1 agonist, which will basically a hormone that incretin, which is called incretin, that will be released. That will tell you that you're full. That will also slow.
Like goes into the satiety center?
Well, you'll feel like you're full. Why? Because it'll slow down the digestion in the stomach. That automatically is that process. When it slows down, you're gonna feel full for hours. You don't feel like eating. You see, all of a sudden, you're not eating as much. You're nauseous slightly. You know, from there, you start that weight loss. It doesn't really start kicking in until about a few weeks. I would say give it about 4 weeks before you really start seeing some drastic change in your weight loss. And the healthy weight loss, remember, it's not 10, 15 pounds a week. It's 1 to 2 pounds a week. That's a good healthy weight loss.
Don't lose 10 pounds. 15
yeah, that's
pounds
just
a week.
unhealthy. That doesn't make any sense. And if you stop the medication, make sure you continue a strict healthy diet. You can't just stop it and then all of a sudden go back into donuts and cheeseburgers and pizza and expect to continue that.
How do you transition then? How do you transition if you want to get off of it? You can't be on it long term forever.
There are patients that are on it every week. And if it's a low dose and it's not causing any side effects, actually they are on it. They can be on it for a long time. Yeah. But it's also pricey, like you said. So if your A1C is not improving, you're not really losing the weight on the medication, then don't take it.
But how do we tell somebody that? How can somebody say I can't afford the food, but I can afford Ozempic? But
I'll tell you, that's why if the insurance pays for it, that's how it is.
Yeah,
bro.
if they pay for it.
Yeah, bro. And there's some insurances that pay for it. So
I think I just have had such bad experience with patients from it that I just. Obviously, again, if they really need it and there's no other option, use it. I just don't.
I have tons of patients that use it, to be honest with you. A lot of patients use it. And I use it for their diabetes, not necessarily for their weight loss.
That's what I'm saying. Diabetes, I'm fine with it.
Yeah. Okay, if you're talking about like people who are not diabetic, but what if they're morbidly obese and they have risk factors? Hypertension, high cholesterol. And
you're saying use it to cut down the weight, then continue that lifestyle, and then get off of it long term, right?
I think personally, obesity is our biggest problem in this country. If we can control obesity, we can control all these other chronic complications a lot better. If you have a patient that is a BMI of 40, you get them down to a BMI of 27, 28, okay? Then all of a sudden their cardiovascular risk is down. Their risk stroke is down. So I just helped them or helped her. Then we can work on it. If they stop it, then we can work on continuing that lifestyle. You know, I feel like some people just need that push.
Yeah,
that makes sense. Just that's all it is. And then when we go from there, but it is a lot of money. It's extremely expensive. Wegovy is $1,300 a month.
Golly,
it's $1,300 a month.
That's
Ozempic is $1,200 a month.
Yeah,
and I don't know what the price is on Mounjaro, but I'm assuming it's the same price, if not more expensive, because it's fairly newer. But it's just. I know one of my friends who is a weight loss specialist. He's a nurse. His name's Sam, and he does a lot of weight loss programs. He has it for a pretty good price. So if this is something you should consider, look into
right?
it. Yeah,
do your homework.
Talk to your doctor too. You can't just
Most
jump into it.
Talk to your doctor.
You have to talk to your doctor.
You can't prescribe it for yourself, and you can't buy it over the counter. So you have no choice but to talk.
Exactly.
But the problem is once it becomes a business, and even for your doctor, you should still do your homework on it and make sure that it fits for what. It fits for you because everybody's so different. Yeah, like somebody like me would not work because
you can't. But you're not overweight.
Yeah,
you're not overweight, and plus, what's another? What another big thing is? You got to be careful. Pancreatitis.
Yeah,
it causes pancreatitis. So patients who have chronic pancreatitis, patients who have old chronic pancreatic issues, you can't use it. Patients who have chronic vomiting or chronic constipation or diarrhea, you need to be careful because you might end up worsening your symptoms, And
people don't understand why the pancreas is even involved in this, and why weight loss is so good for diabetes. Like they need to understand that the pancreas is releasing that insulin.
Yeah.
And once insulin is in that bloodstream, the one thing that pulls the insulin out is adipose tissue, which is fat. So the less fat, the less adipose tissue, the more insulin in your bloodstream, the lower your sugar is.
Exactly.
So, that is very important to understand too.
Yep. And you're decreasing glucagon ultimately, right? Because of the increased insulin. So there is a lot of physiology behind it, and it works, but it's not for everybody. I agree with you. It's not for every person for weight loss. I don't think it should be used for weight loss. I think it should be used for your diabetes, or if you have risk factors,
and weight loss.
obesity, and risk factors that you might be diabetic, start it early, but not for long term, right? Just to kind of give you that jump start.
That makes sense.
So
perfect.
But that's what it is, man.
Make sure you talk to your doctor about it first.
Absolutely.
And we're just giving you guys a little bit of education on it. We're not advising to take it or not to take it.
Talk to us first. Talk to your primary first, and see if you qualify. Ozempic, Wegovy, or Mounjaro.
Perfect.
All right. Awesome. Thanks, brother. Nice to see you, man. All right. Thanks.